From the station working for you, this is WRTV News at 5:30, streaming now.
And now at 5:30, it's health insurance open enrollment season, and with COVID still an issue, we're working to find out what you should know before making your selections. Also, it's usually no surprise what you'll be paying for an item at Dollar Tree, $1. But soon, you won't be able to take their name so literally. The price increase that you need to be aware of.
Topping our lineup, a possible game changer when it comes to wildfires, how a newly approved fire retardant works and where it could be applied next. And nursing home staff shortages are not getting any better, how this is impacting the rest of the healthcare system, and the possible solutions to getting more people to take these critical jobs. Plus, expect to see more loyalty programs this holiday shopping season. We'll be talking about whether they are actually, though, worth your money.
Here at 5:30, we are tracking some severe weather across portions of central Indiana. There you can see a new severe thunderstorm warning that does include the Lafayette area. It runs until 6 o'clock this evening, all part of this larger line of some heavy rainfall here. Going to have some gusty winds around 60 miles per hour, also some quarter-size hail. This is racing northeast, getting into Delphi here a little before 6 o'clock, also into Rossville as we get about 5:47 or so. Some heavy rain, frequent lightning around the Crawfordsville area. And as these storms move through Terre Haute, did knock down some trees and reports of about 3,000 people without power there. Things should calm down a little bit, though, as we work our way to the south and west. Here's a look at TrueCast. Those storms will continue to spread eastward as we go through the next couple of hours, but really our severe weather threat should wind down as we approach about 10 o'clock this evening. Still, though, we have that marginal to slight risk of severe weather across central Indiana with an isolated tornado possible and those gusty winds. Mark?
All right, Kyle, thank you. As the pandemic continues to impact Indiana and with flu season right around the corner, it's an important time to think about your health. We are quickly approaching the time for you to enroll or renew your health insurance benefits. For some people, shopping for health insurance is overwhelming, so they just keep what they have year after year, hoping it's good enough. But with the COVID-19 pandemic still a great concern, we want to make sure that you feel prepared for your health insurance open enrollment period so you can select a health plan that is best for you and your family. That's why WRTV spoke with United Healthcare Chief Medical Officer Dr. Julie Daftari. She says, weigh all your options. Make sure you understand what your copay is, what the insurance co-insurance is, and what the out-of-pocket maximum is. Dr. Daftari says it's important that you consider mental health benefits too.
I think it's very important not to overlook mental health coverage. Your physical well-being is very closely tied to your mental well-being. So definitely evaluate the options that you have in the health plan coverage and look for something like a virtual visit where you can see a mental health provider from the comfort of your own home.
Dr. Daftari says that before you enroll, list your health priorities. For example, if you are into fitness, you may find a plan that includes a gym membership. Or if you are busy or a homebody, you can find a plan that allows and encourages virtual appointments. For Medicare, enrollment runs from October 15th to December 7th. Enrollment for plans under the Affordable Care Act opens on November 1st. And most employers open their enrollment for 2 to 3 weeks between September and December. So make sure you keep an eye out for that so you can be prepared.
Soon you can have access to a pill that could help fight COVID. Merck submitted its FDA request for an antiviral drug that it's made that is taken when a person starts to experience symptoms. They say the trial worked so well at preventing people from getting seriously sick, going to the hospital and dying, that they stopped the blind study and gave the medicine to everyone enrolled who was sick.
We in the medical community and the infectious disease community, we feel that this is a major advance because, as you probably know, the drugs that are available, which are what we call antiviral drugs or monoclonal antibodies, those have to be administered by injection. And so that's a disadvantage.
Infectious disease Dr. Dial Hewlett has had a front row seat to the pandemic from Westchester County, just outside New York City. May remember, it was the epicenter of the outbreak at one point. Now, 90% of its population has had at least a dose of the vaccine. Now, while a pill is a turning point, Dr. Hewlett says it should not be used as a substitute to getting the vaccine.
An ounce of prevention is worth a pound of cure. And so the ounce of prevention here is the vaccines.
A doctor will have to prescribe the COVID pill treatment. The U.S. government has already bought nearly 2 million treatments. It is not clear how much it will cost patients. The medication will only be for adults right now. If it is approved, it could help ease the strain on hospital systems right away. Another possible breakthrough for COVID treatment is on the horizon. It's a late-stage trial data coming in from AstraZeneca showing its antibody cocktail can cut the risk of severe disease or death in half, they say. Data shows the earlier the shot is given, when symptoms first start, the more effective it is. A drug, which is a combination of two antibodies, was also proven to work as a preventative treatment for people who have not had COVID. Meanwhile, more vaccine boosters should be approved soon. An FDA committee meets this week to discuss giving the green light to Moderna and Johnson & Johnson booster shots. CDC also has to discuss boosters and will meet next week. The FDA group is set to consider Pfizer's vaccine for younger kids the last week of October. Wildfires destroy many Americans' homes each year. Next in our lineup, we're looking into a possible game changer when it comes to preventing the flames from even starting. The impact of wildfires is growing. Some 3,000 homes and other structures have already been lost alone this year, and we're just talking about California. Hundreds more could have possibly burned if not for a new product. Take a look at this video from fire chemical solutions company Perimeter Solutions. They sprayed a new fire retardant that's called Phos-Chek around 200 homes recently that were threatened by the Calder fire near South Lake Tahoe, and none of those homes were lost. This was done on behalf of a major insurance company.
We see additional insurance companies saying, hey, we need to protect homes in the face of an approaching fire.
Phos-Chek is similar to the red retardant that you see here that's dropped from planes, except this one is applied from the ground, and it's designed to be more preventative as opposed to reactive. Now, this is video the company took of it being applied to former President Ronald Reagan's ranch near Santa Barbara.
Standard long-term retardants that come out of airplanes are only good to maybe a quarter or half an inch of rain. The Phos-Chek Fortified product has this breakthrough polymer that came out of Stanford that is has durability to a significant rainfall, even past an inch of rain. This is still providing retardant effectiveness.
Now that means that Phos-Chek could be applied once a year at the start of fire season. For an average size home, the cost would only be a couple of $100s, they say. But the best usage will be to address areas where really the bulk of fires start.
Every big fire starts small. And in the state of California, we're seeing about 80% of ignitions starting adjacent to a roadside. Those are very treatable. Treating the vegetation where a car is pulling over and overheating, brakes, catalytic converters, chains dragging. There's so many reasons why that statistic is what it is.
Treating areas under power lines, along railroads and roadsides, and preventing some man-made fires would free up resources to get to the unpredictable ones, like the one started by lightning. Now, the U.S. Forest Service just approved this new fire retardant, meaning it is safe for the environment and safe to be around people and animals. Now, some nursing homes are so short-staffed right now that they've stopped accepting new patients. Ahead in our lineup, the solutions being considered to address this growing problem. If you get COVID, there's a chance that you will have a loss of your sense of smell. The medical community is still trying to figure out why, but Forrest Sanders is visiting with a woman who says her whole life has been preparing her to help people experiencing the side effect.
Finding fresh ingredients and making meals for the people she loves has always been special to Mimi Ellis. Her parents were French immigrants who passed down their love of good cooking.
Growing up, everything was about what's for dinner. Food is such a huge, huge part of my life.
But one morning, while going through an upper respiratory infection, Mimi walked into her kitchen and couldn't smell fresh coffee. She worked as a physician's assistant in an ear, nose, throat practice and knew something was wrong.
I knew that there was a potential that it was never going to get better. Smell is a big part of taste. That informs about 80% of what we think of as taste. Couldn't perceive flavor, couldn't tell you what was an apple and what was a pear. I was really angry. Big time, angry, angry, angry. I literally took all my cookbooks. I put them all in boxes and threw them in the garage.
Mimi told her family then she wouldn't cook again. But one day her mind was changed, and that started with her daughter, Zoe.
My daughter is small in stature. She has a condition, it's the most common form of dwarfism. My daughter's 3'11" and she competed on our high school swim team.
And through her daughter, Mimi also met Paralympians in competitive swimming.
The resiliency was just life-changing.
Nothing was stopping any of them. So Mimi figured, time to unbox the cookbooks. According to the Journal of Internal Medicine, about 86% of people with COVID have experienced a loss of smell, though most of them recover it within 60 days. The pandemic has a lot more people talking about a temporary or permanent loss of smell. Many are also experiencing parosmia, where everything smells bad or rotten.
Yes, there absolutely is hope.
You see, Mimi is now a registered dietitian, a certified health coach, and founder of the program and website Getting Well When You Can't Smell. She teaches courses and does one-on-one Zoom meetings with people who have lost their sense of smell on what to prepare for meals.
Good.
That means training them to use the senses they have and concentrate on the textures of food and the sounds they make when you bite into them.
Hone in on those other sensory aspects of food.
This is called olfactory retraining, one way of trying to return a sense of smell.
I like it. It's very colorful. I mean, it's very big dish.
You get a little bite from the black pepper, and then you put it all together with all these colors and textures and tastes.
A woman who inherited a love of good food now says she has recovered much of her sense of smell. She's grateful to everyone who's led her to this day of helping so many decide what's for dinner. In Atlanta, Georgia, I'm Forrest Sanders.
Soon, the Dollar Tree name won't be so literal. The popular discount store says it has no choice but to raise prices this year. Our consumer reporter, John Mattery, shows us how much you may soon have to pay at Dollar Tree and how shoppers are now reacting.
One of the last true dollar stores, Dollar Tree, is about to give in to inflation and rising shipping costs. And many longtime shoppers are not happy about it. Willa Davenport has been shopping Dollar Tree for years. We found her picking up
some paper towels and some birthday cards.
At a time when drugstore greeting cards can cost $6, here they're still $1. As are wrapping paper and gift bags, food, home decor, even Halloween and Christmas items.
I don't think it's right for them to raise the prices. You go in there to get for $1, and then they tell you it's $1.50. Are they gonna change all their signs?
The good news is that not everything in the store is heading up. Dollar Tree says it plans to raise prices on some items to $1.25 to $1.50. It will also convert parts of many stores to Dollar Tree Plus formats with prices as high as $5. It really shouldn't come as a surprise if you've been to the hardware store, grocery store, clothing store lately. Prices are up everywhere because of higher raw material and shipping costs.
I'm surprised it hasn't happened sooner with the way things are.
Claudia Bly says Dollar Tree items will still be a value at $1.50.
I think people will be okay with it.
But Shannon Cars had hoped it could hold out.
That's why we go there, because it's $1.
Not $1.50.
Not $1.50, $1.
But Dollar Tree has been selling items for just $1 for 25 years. How they were able to keep doing it this year is a mystery. So don't waste your money. I'm John Mattery, WRTV.
Rain and thunderstorm activity filling in here across really the western half of central Indiana at this point. And we do have a new severe thunderstorm warning really just kind of building north and east from the one we've got from around Crawfordsville to Lafayette. That goes until 6, but now until 6:15 into portions of Carroll County. Within that line of thunderstorms could have some 60-mile-per-hour gusts, possibly some small hail in that as well. You also notice we've got a little bit of a line that's building here to the west through Hendricks County down to around Mooresville and Martinsville as well. Nothing severe there. And then as we work our way back through Spencer and into Clay County, we've got some moderate to at times some heavy rain. Those rain chances fairly high for us through about midnight, and then they really start to drop off. I think we'll be dry by tomorrow morning. But we look west out of downtown. There you can see that line that's over in Hendricks County with the rain, and it will be making its way towards the east and northeast. Even can maybe hear some of that thunder in the downtown area. It is 76 degrees. We've got a southeast breeze out there between 15 and and 20 miles per hour. Rain influenced air here, 66 degrees in Terre Haute. It is 10 degrees warmer though downtown, 80 in Anderson and 84 in Muncie. Tomorrow still going to be a little breezy for us, those winds out of the southwest. So that keeps our temperatures from really getting much colder. It's just a little cooler out there tomorrow, as we'll only make it into the 70s instead of the 80s. We got another 80-degree temperature though coming our way on Thursday. Seasonably cool though for the upcoming weekend. Highs in the low to mid 60s. Chris?
Chances are, if you are trying to find a nursing home for your parents or grandparents, there might not be any beds available. It's because of a nationwide shortage of nursing home staff. And as Chris Conti shows us, it is creating a crisis across the entire healthcare system.
It is hard not to notice the darkness which has enveloped nursing homes across the country. Empty beds, empty hallways, at a time when they have never been more needed.
Every day is a new battle. There is no such thing as we've turned the corner, everything's going to be fine.
Paul Listro's family has owned Manchester Manor Nursing Home in Connecticut since it first opened in 1966.
What we're sure of is that every day in this country, 10,000 people have become 65.
But this is the first time he can ever remember being so short-staffed.
People for the first time started recognizing that maybe this isn't ever going to go away.
At full staff, this nursing home has 175 nurses working. Right now, that number is closer to 145. Because of regulations, they are one nurse shy of opening this new wing of the nursing home. One nurse is all they need. Instead, 16 brand new beds are sitting here empty.
As long as the beds are not filled, it's always a sign of we're short-staffed.
So what's happening? Part of it is pay. Nursing homes have been underfunded by Medicare and Medicaid for decades, keeping salaries low. Part of it, though, is simply the pandemic.
It was pandemic fatigue. People said, there's no amount of money that will keep me here anymore. And that's when we started losing people.
All of this has implications for the rest of the healthcare system. If a patient can't be sent to a bed to recover at a nursing home after, say, a surgery, that person then ends up having to stay in a hospital longer, at a time when ER capacity is already being taxed.
It's been a really challenging 2 years.
That's David Gifford with the American Healthcare Association. He's seeing an unprecedented exodus at nursing homes.
The staff are exhausted. They're sort of burnt out. And as in many professions, many of them are thinking of leaving.
Since the start of the pandemic, an estimated 400,000 people have left the profession. Half of all nursing homes in the U.S. are so short-staffed they aren't accepting new patients. In an effort to entice more people to enter the nursing home industry, AHCA is lobbying Congress to offer loan forgiveness and tax incentives to workers.
The question is how are we going to get them to come to our setting? And that's where we've been focusing our efforts.
Back at Manchester Manor, Paul Listro is trying to be more competitive, raising starting salaries from $17 an hour to $20 an hour. Even that, though, hasn't been enough.
What we didn't expect, though, was everyone else to start raising their salaries. So, yes. So we're competing with Walmart and Amazon and any number of other, even some fast food locations.
And so this industry that is so critical to this country's aging population continues to navigate its way through the pandemic as needed beds sit empty. In Manchester, Connecticut, I'm Chris Conti.
All right, Chris, thank you. Now, some good news here. Dr. Fauci says that parents can safely allow their kids to take part in Halloween and go trick-or-treating. He says that kids who can get vaccinated for COVID should do so. The vaccine is authorized for children 12 and up. Now, finally in our lineup today, companies are offering new perks to loyalty programs due to supply chain issues. We're taking a look into whether these programs are worth the money for the holiday shopping season. Black Friday style sales have already started with supply chain issues top of mind right now. Best Buy is pointing out product shortages and shipping delays as part of its new annual membership program. It's giving members access to hard-to-find holiday items throughout the holiday shopping season and special prices starting next Monday. You can expect to see more loyalty programs just like this. There was a recent survey from KPMG that found 55% of companies say they will have loyalty-specific marketing events during the holiday shopping season.
What draws consumers the strongest motivating promotional activity are what we call temporary price reductions. And that can be a percentage discount or a dollar discount. And that's still the strongest draw is what we're seeing. Loyalty programs are also a core component to that marketing mix.
Big question is whether these loyalty programs are actually worth your money. Best Buy's, for example, includes an extended 60-day return and exchange window for most products, and it's $200 a year that you pay for it.
When we think about what a consumer is looking for, they're definitely looking at the benefit to them versus that kind of the barrier to entry, so to speak. So whether it's the nuisance of filling out a form or, paying a fee.
I would say, though, that you need to be a loyalist to make it worth it. And I would also urge people to consider what might already exist in other formats. For example, a lot of credit cards will give you an extended warranty for free just by using the right card.
That means you need to plan to buy multiple items from the company in the next year to potentially make its membership worth it.
For more of the one-off, it may actually make more sense to either go through a credit card warranty or even just, pay out of pocket sometimes for a service plan.
A handful of scientists around the world are trying to create a universal vaccine that aims to protect against not just COVID variants, but future ones as well. Tomorrow, how close they say they are to developing the next generation coronavirus vaccine.
Some areas of moderate to even heavy rain here across the western half of the state and the northern portions of this once you get into Carroll County. Potentially some severe weather there. We've already had these storms with reports of wind gusts and some power outages. Kevin Gregory will continue to track these storms for you. The news at 6 starts right now.